Hey family, welcome to another episode of the Rotator Cuff Experts. So today we're going to talk about something a little bit different than what we've talked about before. I get this question asked me time and time again: how do I pick an orthopedic surgeon? How do I pick specifically a shoulder surgeon who's going to do rotator cuff repair? So we're going to have 5 tips on how to pick them. One tip actually will be an anti-tip: how not to pick, what not to do, who not to pick. And this may be counterintuitive to you because some people think this is super important, and I actually perfectly think as an orthopedic surgeon, I think this is actually not important at all, and maybe it's actually a negative important thing. So stay tuned for that. So right now we'll talk about what qualities, what should you look for in an orthopedic surgeon who you allow, because it actually truly is who you allow to fix your rotator cuff. Because you have lots of choices. And do not feel like you're bottlenecked into one choice. If you met one surgeon who's done something for you, it doesn't mean that they need to do the shoulder for you. Or if you met someone who you only have seen for your shoulder and you're not feeling quite right with it, you do not have to do surgery with them. There will be plenty of other orthopedic surgeons around who will be more than happy to take care of your rotator cuff surgery if you do not feel comfortable with the one that you're with, right? It is not love the one you're with. Find the one you love and stick with them, okay? So number 1, this is really key, and some people may disagree to some degree, but how many years in practice, okay? So I've been in practice for about 15 years. So I've seen a lot. I don't think 15 is the perfect number, but I think you need to be in practice 3 years, enough so you are on your own. You do not want this to be your patient's first rotator cuff repair. You don't want that, because no matter how good we are, no matter how much practice we've had in the confines of a residency or fellowship, and we'll talk about fellowship in a second, we're not ready. I mean, we're ready, but we're not perfect. We're not really as good as we can be 10, 15, 100 times into doing a rotator cuff repair. So if you say, how long have you been an orthopedic surgeon? This is a tricky question, because technically after we're done with our residency, we will be an orthopedic surgeon. But most of us, or lots of us, do a fellowship. It's another year of extra training. And so say, how long have you been in practice on your own outside of education? If they say, I just started yesterday, or I just started a little while ago, probe to find out what that really means. Because if they've been in practice for 6 months, they may be an excellent surgeon, they may become an excellent surgeon, but that may not be the person that you want to be with, okay? So time of being an orthopedic surgeon is super critical, so pay attention to that one. 2, how many rotator cuff repairs do they do a month, let's just say? I mean, you can use a year or a week or whatever, but let's say a month, okay? Because not just how many shoulder surgeries do they do, or not just how many surgeries they do, because depending on the orthopedic surgeon, they may do lots of things, or they may be very narrowed. And so you don't really care how good they are at doing a knee replacement, because you're having a rotator cuff repair. So if they are a knee surgeon and occasionally do a shoulder surgery, that is probably not what you want either. Some people can do it, and I'm a fairly broad orthopedic surgeon, so I think I can do it. But you need to know, if they do 1 rotator cuff repair a month, that's not where you want to be either. So you want probably, even if they do 1 a week, 2 a week, 3 a week, probably 3 is, to me, in my personal opinion, 3 is probably the low end. So 3 times 4 weeks, so 12, maybe 10, 8, 10, 12, something like that. You want them to have significant experience every week doing that procedure. And it may not be rotator cuff, but let's just make it a little bit wider. Shoulder arthroscopy, working on the shoulder, not necessarily replacing, but replacing would be fine too. How many shoulder surgeries do you do a month? If they say 8, 10, 12, then I think you're good. Sometimes for me, I might do 4 in a day, and I do 2 surgeries a week, so that would be 8 a week, so I might do 30. Something like that. That's probably an unusual month, but I might do a lot. So 8, 10, 12, the number of orthopedic surgeons that do 8, 10, 12, you will be in a good standing as far as them having lots of experience and not being surprised with what they find in your shoulder. Along those lines, do you do it arthroscopically or do you do it open? Now, these two are probably not that important. open arthroscopic. If we look at the results, probably arthroscopic is a little bit quicker recovery, a little bit less pain, but they both hurt, unfortunately, and they both require time to recover. But someone who is more proactive in their learning, at least now in 2019, so depending on when you're listening to this video, in 2019 and beyond, most shoulder surgeons will at least be doing most of their shoulder surgery, most of the rotator cuff surgeries arthroscopic. So if they're not doing it arthroscopic, you should pause, because that means they're either old school, older in generation, or they are not as comfortable as doing scopes, and so maybe that's not the person you want to be. So before we're going to go any further, key thing, if you have any questions or comments, please leave them below, and I will address them either directly to you or through the comments below. Any questions, please answer. Please be interactive, because I want to know what you want to know so I can help you know what you want to know. How many rotator cuff repairs and how do they do it? Open arthroscopic. Again, not crucial. So if you get a 55, 60 something year old guy or girl and you think they're awesome, they're great bedside manner, everything's wonderful, they're a little older, so they may do open, and they do a lot open, then I think that's fine. But but if you should just keep that in mind. Okay, so number 3 of 5, are they fellowship trained? Is this super important? So what's fellowship? So 5 years, so let's go through this. 4 years of college, 5 years of orthopedic training, 1 year of fellowship. Okay, so after 5 years of orthopedic training, you can do whatever you want to do. Spine surgery, foot surgery, knee surgery, shoulder surgery. You can do everything. But most of us decide we're going to want to do something more than that, in a little extra special arrangement where you're only really focusing on one thing. So for instance, for me, I did a sports fellowship, which means we do a lot of shoulder arthroscopy, knee arthroscopy. We do that for a year. We need a lot of volume in that year. So that volume in that year will help us to be better at what we're doing in the long run. Is it crucial to have a fellowship? Again, has to do with generation. So lots of people above my generation, although it's getting less and less. I used to be young, now I'm not so young. Less and less people will be apt to not have a fellowship. More and more people, as time's gone by, have had reasons or have desires to do a fellowship. So maybe the 60, 65-year-old may not have done a fellowship, but actually may have been done or may have pretty good experience and maybe didn't need a fellowship. But that's the key thing. That would be something you would want to ask your orthopedic surgeon. So we're going to do this top 3, and then we're going to jump on to the next episode to do the next 2, and the surprise of what's one thing that you think is important that probably is not important and may actually be detrimental. So you should talk with your orthopedic surgeon. How long have they been an orthopedic surgeon, right? So that's number 1. How many rotator cuff repairs or how many shoulder surgeries do they do a month? 8, 10, 12, something like that. If they do less than that, you should pause, okay? And fellowship trained. There may be reasons why you might not be fellowship trained, but fellowship trained. Oh, and a little bit side note, where were they trained? Meaning that, were they trained in the U.S.? Now that you can't be trained outside the U.S. and be just fine, but that's a little bit more unknown. So we don't know. So if they're from, if they have been trained in Europe, or they've been trained in Africa, or they've been trained in Asia, we just don't know those things, those details and there's not quite as easy to find that out. So anyway, so those are the 3. Years of service or years of practice, rotator cuff repairs, shoulder surgery, how many, and 3rd, fellowship trained. Are they not? So we're going to stop here. Again, please leave messages, comments, questions below. We're going to do a quick part 2 in just a minute to talk about the next 2 reasons and the reasons why you should maybe avoid what you think you need. Anyway, Dr. Daniel Orcutt, always a pleasure to talk to you. Always a pleasure to answer your questions. Let me know. We'll talk to you soon.